This is Ask the Expert, the series where we answer your most asked health questions with clear, honest, clinical advice. My name is Aamina Rafiq and I'm the lead pharmacist.
And I'm Abdal, Alvi, the clinical director. Last time we spoke about Mounjaro, and this time we'll be focusing on Wegovy, how it works, what to expect, and whether the treatment is right for you.
Okay, so one of the biggest questions that we get asked is, how does Wegovy compare with Mounjaro? So let's start there. Our first question is, what's the difference, Wegovy versus Mounjaro?
So Wegovy and Mounjaro are both injectable treatments used for weight management, and they both work by mimicking hormones that are found naturally in the body that are responsible for regulating a person's appetite. Wegovy contains an active ingredient called semaglutide, and Mounjaro contains an active ingredient called tirzepatide. Wegovy works on one receptor called GLP-1, and Mounjaro works on two receptors, GLP-1 and GIP. This means that for some patients, Wegovy works better for them, and for others, Mounjaro works better for them. But the key thing to remember is that they're both highly effective medications, which, alongside lifestyle changes, can really make big impact on a person's health. The right option depends on you, it depends on your body, it depends on your goals, and of course, a conversation and assessment with your clinician.
Amazing, thanks Abdal. So our next question that we have is, how does Wegovy work?
So Wegovy works by mimicking a hormone that's found naturally in the body that's responsible for appetite regulation. And in doing so, you feel fuller quicker and for longer. And it also allows you to manage cravings. So it makes you crave high fat and high sugar foods a lot less, such as chocolate and cakes. And interestingly, it doesn't do that for fruit and veg.
That is very interesting. So another commonly asked question is, does Wegovy help with heart health?
Yes, it does. Wegovy is the only product within these category of medications that is actually licensed for its effect on cardiovascular health.
Okay.
There was a major study that was actually done in this, which showed that it reduces the risk of patients having heart attacks, strokes, and heart-related death, particularly if they're overweight and have underlying issues with their heart already, and it can do so by anything up to 20%, which is really quite something. And what's really interesting is that the benefits were actually independent of weight loss. So it showed that it's got a direct impact on our heart function as well. This is a key long-term benefit that I think a lot of patients are not aware of.
Yeah, and I think it's something that, as with a lot of new medications, you end up having new findings of benefits that they're having. So it's pretty interesting to see what other benefits in patients' health that this is going to cause long term. So that's really good to know. Our next question that our users have is, how fast do you lose weight on Wegovy?
And it's a question that we get asked a lot of the time, and patients quite often have quite unrealistic expectations, maybe because of what they've seen online or on social media. It's important to note that the amount of weight loss that a person experiences really depends on the individual, and it varies quite a bit from person to person. Some patients start to notice changes quite earlier on, and for other patients it can take a few months. And if it does take longer, that's not necessarily a bad thing. In clinical trials, patients lost between 15 to 17% of their body weight, but that was actually measured over a 6 to 8 week period.
Yeah.
Which just goes to show that patients need to have realistic expectations and to make other changes to their health, particularly around their diet and around their movement, so that they get the maximum benefit from treatment. It's important to note as well that rapid weight loss is not always a good thing. Losing weight too quickly can be hard to sustain. It can lead to tiredness. It can lead to poor nutrition. It can even lead to muscle loss. So what we want to see is slow, steady progress, and so that patients are building habits that will last them into the future.
Absolutely. And I think something that we always emphasise to patients is just having a little bit of patience with yourself and with the medication and with this journey, because it's not going to happen overnight. Like you mentioned before, it's a slow, manageable journey. And if you make those changes slowly over time, you're going to sustain it for a longer time. So I think that's just something else to just remember. Patience is key. Our next question that we have is, how long can you take Wegovy for?
So Wegovy is actually designed to be used for the long term, and technically there's not really a time limit for which you can use it for. As long as patients are seeing benefit for the treatment and as long as it remains safe for you to use, then it's actually fine to use for as long as you need it. A lot of patients feel that when they get to a healthy weight, they worry that we're going to stop prescribing the medication for them, and they shouldn't do so. We completely understand the fact that sometimes it's a lot harder to maintain some of your weight loss wins rather than to lose the weight in the first place. And so we really support our patients in entering what we would term a maintenance phase. It's important for patients to be honest in their assessments and to give all the information the prescriber needs to be able to make the best decision for them. If a person's weight has stabilised and they've made some positive changes to their lifestyle and to their habits, it might be a good idea to adjust the dose or to even consider coming off treatment. But that's a decision to make alongside our clinician. Patients really need to start thinking about these medications less as a short-term fix and more as a long-term tool to actually help them change their health for good.
Absolutely. Thank you, Abdal. The next question that we have is, what happens if I stop taking Wegovy? Will I regain the weight?
So there is a good chance that when patients stop taking the Wegovy that they do regain the weight that they've lost. And there have been studies that have shown that patients that have used it in the long term have gone back to their starting weight. Having said that, though, there's also been some studies that have shown that the longer that you use these treatments, the less likely you are to put on all of the weight that you've lost. Why? Because alongside the medication also comes better habits to do with your diet and to do with movement as well. So the treatment should ideally be viewed as a longer term treatment as well. And one of the key things to note is about how Wegovy actually works, because it works by mimicking hormones that are found in your body that are used for regulating your appetite. Obviously, when you stop using the medication, those hunger signals can then return, and that makes it harder to manage both cravings and your portion sizes as well. So it doesn't mean that you will automatically start to regain the weight that you've lost. But again, it's really important that patients are building healthy habits around their food, around movement, and around their mindset as well. And that can make a really big difference when it comes to keeping the weight off in the future.
Absolutely. Thank you, Abdal. So our next question that we have is, who shouldn't take Wegovy?
So Wegovy isn't suitable for patients who are pregnant, who are breastfeeding, who have got a history of some thyroid cancers, who have pancreatitis, or who might be on certain medications. The key thing here, though, is that patients should always try to obtain the medications from regulated providers. There are a lot of patients that try to access these via social media and via unregulated providers, and you need to be really careful. Being injectable, prescription-only medications, patients need to take where they're obtaining them from very seriously. And it's important that if you go to a provider and they don't have an assessment or they don't have a regulated healthcare professional, patients should be suspicious of that. So it's important to buy it from a registered pharmacy, and our team are here to help with any questions that patients might have.
Absolutely. So I think the key takeaway is making sure you're obtaining it from a registered prescribing service, and also making sure you're filling it out very honestly and not omitting any information about your medical history or condition to make sure that you are getting this safely.
Absolutely, because the assessment is really key to the healthcare professional making their decision about prescribing or not.
So our next question that our users have is, can Wegovy make you tired?
So the medication can make a person feel tired, particularly earlier on in treatment, and quite often this can settle for a lot of patients. It's really important that if the tiredness is bothering you or affecting you too much, that you do speak to a member of our clinical team. And it's equally really important to make sure that you're actually eating enough, because that will make sure that you're maintaining your energy levels and thereby not feeling too tired throughout the day. I would also mention that it's really vital for patients to be maintaining a good level of hydration while using these medications. That will help not only with tiredness, but it can also actually help with a range of other potential side effects.
Amazing. That's good advice. Thank you, Abdal. So let's move on to our following question. Can Wegovy cause hair loss? And I know that this is something that a lot of patients do worry about.
Yeah, and it can be very worrying when you're noticing that you are losing your hair, particularly when you're starting any new treatment. And hair loss isn't something to worry about for most of our patients, but of course can happen. And quite often it can happen indirectly. And what I mean by that is that when a person is losing weight quickly and they've maybe made changes to their diet and they're maybe not getting the nutrients that they need, the body can sometimes respond by slowing down some of the non-essential processes, such as hair growth. That kind of hair shedding does tend to be temporary though, and a person's hair does tend to grow back, and it does tend to improve once a person's weight stabilizes and once their nutrition is back on track. Again, it's really important to make sure that you're eating enough and what you are eating is well balanced as well. And if you're skipping meals or you're eating very little, not only is it going to affect your hair, but it can certainly affect your skin as well, and maybe even make you feel a lot more tired. If you're worried about hair loss when it comes to Wegovy, please do speak to a member of our clinical team. They can look at your food intake, they can look at your dose and make any suggestions needed.
Amazing, thank you. So the next question that we have is, can I drink alcohol while on Wegovy?
So the quick answer to that is yes, you can do. It can make some of the side effects a little bit worse, such as nausea and vomiting. If anything, there is growing evidence to suggest that it might actually reduce people's cravings for alcohol. But to answer your question, yes, it's perfectly safe to drink while using Wegovy.
Amazing, thank you. So the next question that we have is, what should I avoid eating on Wegovy?
Changing your eating habits is actually a really big deal, and Wegovy can help ease people into that transition. One of the ways that it works by actually mimicking hormones that are responsible for appetite regulation is that it reduces your cravings for high fat and high sugar foods like chocolates and cakes. It's really important that patients are mindful about what they eat. Not only will kind of heavier, richer and oily foods possibly make the feelings of nausea and vomiting a little bit worse when a patient is taking Wegovy, but also those types of heavy fried foods, creamy sauces, ultra-processed foods can sit in your stomach and just make you feel unwell generally. It's important to note, though, that it's not essential for patients to make drastic changes overnight.
Of course.
Small, gradual, sensible changes are really vital to actually developing habits that are going to be sustainable in the longer term. Our team is here to support all of our patients. There is information on healthy eating and on recipes available on our website and on the Renew app as well.
Amazing, thank you, Abdal. We also will be having one of our experts join us in future episodes to go through diet, nutrition, so that should hopefully help answer some questions for our patients and maybe just give them some tips to help them on their journey. So our next question that we have is, why is Wegovy not working for me?
So it's really important that patients have got realistic expectations around the medication and about their weight loss journey. For some patients, they might notice benefits earlier on. For others, it can take a number of months. If anything, the studies that looked at Wegovy and its effectiveness actually found that patients were losing between 15 to 17% of their body weight over a 68-week period. So quite often patients are expecting the medications to work really quickly, maybe because of something that they've seen online or maybe because of an influencer that they're following on social media. But realistic expectations are very important. It's also important to note that patients respond to medications very differently, and factors like your starting weight, your body composition, your lifestyle and your diet, and how your body is just reacting to the medication can all play a really important part. Having said all of that, if it's been a reasonable amount of time and you feel the medication isn't working for you, then please do speak to our clinical team. We can give you advice on your progress, on making any dose adjustments. And, it's interesting that even sometimes small changes in your diet or in your activity, or even the way that you take your medication, can make a really big difference.
Absolutely. Thank you so much, Abdal. And that's all for today's episode of Ask the Expert. We hope that we've managed to answer some of your commonly asked questions around Wegovy.
And if you found it useful, please do like the video and do subscribe to our channel for more content just like this.
Thanks for watching. We'll catch you in the next episode.